Okay, we're going to get started now. I'd like to first introduce myself. I'm Brooke Doyle, Commissioner for the Department of Mental Health. I'm really pleased and honored to join all of you here today and want to thank you all for joining the virtual 9th annual Stephanie Moulton Symposium. Although I regret that we can't come together in person, the goal of this event remains the same: to join one another, to share and learn best practices for promoting safety in our care communities. Before we get started, I'd like to share some information about participation and the technology that we're using. All of the participants are muted and cameras will remain off for everyone except for today's presenters. A link to the agenda is available in the chat function, which is located at the bottom of your screen. The ability to chat is disabled for today's event, but the host will place some information in the chat for your use. When we get to the question answer segment, the facilitator will explain how to submit your questions to the panelists. We appreciate your patience with this new format and any glitches that we may encounter. This year, we're all facing the added challenges of managing our many responsibilities during the pandemic. Many of you are juggling work, managing children's school, or caring for a loved one, and the pandemic has changed all of our lives. Today, as we talk about workplace safety, I also just want to thank everyone for your commitment to the work, to acknowledge that this has been and continues to be a challenging time in our country. Yet, the work we do with such steadfast dedication is so critical to those we serve. With that in mind, we will focus on strategies that promote direct care worker safety and well-being, and given the unique challenges of the time we're in. Since we planned an abbreviated event this year due to the virtual format, most of our time will be spent with a panel of direct care workers. We are very grateful to these presenters for taking time away from their already full schedules to share their perspectives with us and their expertise regarding best practices. I'm so grateful for the opportunity to honor the memory of Stephanie Moulton by selecting Stephen Barrow as this year's award recipient for the Stephanie Moulton Memorial Award. We will hear more about Mr. Barrow's contributions during the award presentation. And it's enormously important that we recognize and memorialize the kind of passion and commitment Stephanie brought to her job as a direct care worker and an aspiring nurse. The Department of Mental Health is honored to sponsor this important event, which is dedicated to promoting quality, effective healthcare, mental health care by ensuring safety and respect that guides everything we do as direct care workers, clinicians, and administrators. I also want to thank Kim Flynn, Stephanie's mother, for the inspiration and focus she and Stephanie have given us over these years and continuing even through this difficult time as we strive to find better ways to promote recovery in our community programs and inpatient units. Each year, we have a chance to hear from Mrs. Flynn, and we respect her unwavering commitment for promoting safety for the direct care workforce. I also want to thank the Massachusetts Association for Mental Health and the DMH Planning Committee for the work they do every year to organize this event. Planning for this symposium builds on evaluation comments from the previous year. We hope we will meet your need for practical information and guidance. And each year we make efforts to tailor the content of the conference offerings to match the evolution of our collective learning. Please continue to provide your feedback through the evaluation process. As we prepare to welcome our panel of experts, I would like to invite you all to participate in a brief poll regarding how people are navigating the times in which we are all living. Then we will offer an opportunity to reflect on how important it is to create a space to be kind to ourselves during these stressful times. And we will set aside a brief period of time to practice mindfulness. Our goal today is to honor Stephanie and the living memory of your own kindness, compassion, and quality of care. Now, I would like to introduce you to our program facilitators. Earl Miller is the Director of Recovery Services for DMH in the Western Mass area. He's a certified peer specialist. Earl previously worked for the Western Mass RLC and the Center for Human Development, and founded Finding Shelter Through Peer Support, a first of its kind peer-led housing support service. Chris Cordero is a clinical training specialist in the Southeast area and is a licensed independent social worker. She began her career in a residential setting, including in the role of clinical director at 2 of them. She has experience providing community-based therapy and crisis intervention services. Before her current position as training specialist with DMH, she was the program director at an adult community clinical services program in Fall River. And I will now turn it over to Earl and Chris. Thank you.
Welcome. I think this is, a really important time, and we really want to start the day by thinking about how do we take care of ourselves. How are we keeping ourselves in the game as we navigate these trying times? Me and Chris had the opportunity to have several really interesting conversations about the kind of natural stress of the work we do last year, and how none of us could have foreseen the sorts of decisions and choices we'd have to make this year on top of those. So I'm excited to introduce Chris to introduce the poll and really give you all an opportunity to provide some feedback to us all.
Thank you, Earl, and good morning, everyone. As Earl was saying, we continue to navigate through these uncharted territories, and as we do, we have continued to care for others, both in our professional and our personal lives. I know some of you became part-time teachers and didn't even apply for that job. So we'd like to take a few moments to focus on caring for ourselves. And I would like you to think of self-care as the ability to keep our glass of water filled in order to help replenish others. And we're going to pull up a poll. And what we'd like you to do is to take a few moments to answer the poll. And we'd like to know right here today, Thursday, December 3rd at about 10:10 in the morning, how full is your glass feeling? Are you full to the top? Do you feel like you're running on empty or maybe somewhere in the middle? Again, we're asking, how full is your glass before you start to care and replenish others? And we'll give everyone a few minutes to complete that poll, and then we'll take a look at the results.
I think it looks like the majority of you have participated, so we're gonna pull up the results now. Wow. So it looks like we're all kind of in the middle somewhere, although it looks like we lean towards having some space and something to give today. That's a really wonderful thing to see. I think if we ask this question in 10 minutes before or after, I imagine it might look different. Uh, but this is really helpful. And I think as we go through the day, think about the reality that everybody who's talking today, from the doctor who's going to lead us soon in an activity to the panelists, is going through the same process of trying to replenish their glasses to provide support to the folks who desperately need it. So thank you for participating. I know participating doesn't always feel like the fun thing to do at 10 o'clock in the morning, but you did. So thank you. And Chris, please introduce the doctor to lead our activity.
Yes, with pleasure. So I'd like to introduce to you Dr. Saida Nuzat. She is the facility medical director at Taunton State Hospital. She's also an assistant professor at UMass Medical School. And she's going to be talking a little bit about the scientific evidence supporting the benefits of meditation, which is part of self-care, as well as leading us in a brief meditation exercise. So take it away, Dr. Nuzat.
Thank you, Chris. So my name is Sayyada Nuzat, and I run a mindfulness practice group in Taunton State Hospital, which is open both for patient and employees here. So, and I want to talk about mindfulness as an important part of self-care and compassion today. As the saying goes, everything we do can be done better from a place of relaxation, and our ability to generate output is directly proportional to our ability to relax. And Aristotle said, knowing yourself is the beginning of all wisdom, and mindfulness is an important way of getting to know ourselves better. So, what is mindfulness? It is the awareness that arises from paying attention on purpose in the present moment, non judgmentally. So, there has been a tremendous increase in the neuroscientific research supporting the benefits of mindfulness in the past 4 decades. As you can see in the next slide, back in 1970, there was only a handful of studies supporting mindfulness or meditation. And in the year 2015 or 16, there has been 1113 articles supporting the benefit of mindfulness and meditation. And number has been increasing since then. Next slide, please. And yes, so back in 2015-16, there has been 1113 scientific publication. And today, I just want to bring your attention on 3 areas where mindfulness has shown to be very effective. So this is the slide of our wandering mind. This is the midline structure in our brain, that's medial prefrontal cortex and posterior cingulate cortex, that get activated when we have thoughts going on in our mind. And these thoughts are usually related about something we have done in the past or we are planning to do in the future. And sometimes they lead to impulsive reaction. As compared to next slide, which is a slide of the areas in our brain which get activated when we have mindfulness or restful mind. This is dorsolateral prefrontal cortex. When it get activated or when it lights up, that's when we have a calming effect. In next slide, I will show you um, the talk about reward-based learning, which forms the basis of all our habits or even addiction. So what happens is whenever we have this feeling of dis-ease or discomfort, and we are not quite sure where it's coming from, this trigger leads to some kind of behavior. And this behavior then activates the reward system in our brain. But the only problem is, we can go back to the same slide. The only problem is our mind tends to remember this experience in the form of memory. And then next time, if we want to feel good again, or we want to avoid the negative feeling, our mind presents the same option. Remember last time you drink a big sugary drink, when you smoke a cigarette or has a glass of wine, how did you feel? Good. It even applies to our social media, use of our social media, and also our addiction to our own thinking. So research says that mindful help us to get connected to ourselves and help to see our thoughts more clearly, so then we can do something about it. I usually use analogy of having a small wound, and if we keep on scratching it, it's not going to heal. All we need to do is some time to leave it alone and keep it clean. And the third area of neuroscientific research, which is in next slide, is telomeres. So the DNA of all our cells, the end of the DNA is covered by a protective sheath of protein called telomeres. It's like the plastic tips of the end of on the end of the shoelaces, which prevent them from wearing down or fraying. So these telomeres, if they are healthy, they help us to live younger, healthier, and longer. And there are certain behaviors we can do to keep our telomeres strong, like eating healthy food, doing exercise regularly, having a good sleep, and also meditation. Research says meditation, mindfulness help us to keep our telomeres strong and longer. So coming back to meditation, we as a human being, we all have a capacity to focus our attention and then dwell in the space of awareness, which is non-reactive. And once we have the focused mind, then we can expand the awareness and can see our thoughts more clearly. Focused mind and open mind welcome all that shows up in our field of awareness, and attention and care focused on ourself builds resilience, which is maintaining positive effect and well-being in the face of adversity. Another thing mindfulness does is it helps to develop attunement. Attunement with other leads to stable relationship, and attunement to ourself leads a powerful feeling of coming home, getting connected with yourself, connection with our being. So we have this powerful feeling of coming home and meeting ourselves and getting out of our own way. So now I would like to run a brief practice. It's a 3-minute practice and it's a part of my daily routine. It usually helps me to calm down, and it has 3 parts. First part is becoming aware. So please sit comfortably, and you can close your eyes or you can place your gaze 5 to 6 feet away from you. Now connect with your breathing. Breathe in and breathe out, making sure breath out is longer than breath in. And with this awareness, ask yourself, what is my experience right now? What are my thoughts? Any feelings? Bodily sensation? And wait for the responses. Acknowledge any thoughts that shows up. Label your feeling, even if they are unwanted or unpleasant. Notice any pushing away of the experience and soften around it, allowing space for all that shows up in your awareness. Next is gathering your attention. Gently place your attention on your breathing. Notice each inhalation and each long exhalation. Follow each breath, one after another, one after another. Using your breathing as an anchor into this present moment, tuning into a state of stillness which is always there, right below the surface of your thoughts. And this stillness allows you to come from a place of being. Next is the expanding your awareness. Sense your field of awareness expanding around you, around your breathing, around your whole self. Notice your posture. Notice how does it feel when your eyelids touches each other. Notice the meeting of your lips with each other. Any tension in your neck or in shoulder? Notice how your body is resting on the chair and how ground is holding your feet. Soften any tension. Befriend all of your sensation. Greet them with kindness. Meet them with compassion. With this expanded awareness, connect with your whole body as if you are breathing as a one whole unit, encompassing all that is in you, acknowledging all that is in you in this present moment. And now we can slowly open our eyes. And thank you very much. And I turn over to Earl right now. Thanks.
Thank you so much, doctor. That was, I feel super relaxed. I'm going to have to figure out how to get my energy back up for the panel. Um, Thanks everybody again. This panel, I think, is a real opportunity for us to take a little bit of a tour around the Commonwealth. We are, oh, everybody can see the references? Okay. Thank you for being patient with us. We're figuring this out. This is new. Hopefully we won't have to do this again, but if we do, we'll be really good at it. So again, we have a really interesting, thoughtful panel today. They are each going to speak for about 5 minutes on risk. I just want to preface, you're going to hear a lot about COVID because it is first and foremost in folks' minds. We recognize that that doesn't preclude any of the other sort of safety things that we need to think about. And we've been mindful about that, but I know if we're all a little overwhelmed and over COVID. And I think that is all the more reason why you're going to hear how folks are thoughtful about it in their safety planning. So we're going to get going. I am fortunate enough, we're going to open up with a dynamic duo. Kathleen McCarthy, registered nurse, the infection control nurse from the Brockton Multi-Service Center, and Shannon Knight, an LMHC and the DMH PAC director in the Southeast. They're going to share about how they have navigated through this with PAC and as a group, how they've worked through this. So I will pass it on to you two. Thank you.
Thank you very much, Earl. And I want to thank everyone for inviting me and Shannon to participate today. We appreciate that our work to keep staff and clients safe is being recognized and shared today in this important forum. Our community experiences and need to deliver safe care has really led us to become creative during COVID. And that's all because we've all shared the fear of the unknown, especially like early in this crisis. We right away started planning like how are we going to still meet the needs of our clients and deliver them safe nursing care and direct care. It was overwhelming, the amount of information that was being disseminated at all levels and changing and being revised almost on like a daily, weekly basis. I more than ever appreciated the support I got from a team of nurses in the Southeast area because we were able to go back and forth with each other to make sure we were giving the right advice because we were relying on CDC, DPH, DMH, and the guidelines were just tremendous amount of work to keep up and current with. Okay, and I still rely heavily on them now that we're still going through this period of the surge and doing our best in the community to keep everyone safe. So right at the start of the pandemic, the teams talked about, how to most safely deliver care to our clients, that some being seen previously on a daily or a couple of times a week basis. And, schedules were staggered for staff that were on site, but direct care staff in the houses had to be there 24/7. And it was very important to support people that worked in the group living environments and also the clients that they cared for. So everything we tried to do with the staff around training, we also tried to do with clients. And I know we all know what COVID precautions are. So we did some things that we probably wouldn't usually do. Like, of course, we met a lot of people through screen doors, outside, in their driveways, in their yards. I've administered medication outside in private areas. And all this time, you have to remember to respect someone's dignity and do it in the safest manner possible. And, we had some few good laughs about it, because they used to say, I need to worry about you. You're the nurse that's going places. I've been staying home. So, it really created a different kind of human bond with the people we serve, because we were all in this equally together. Okay. I relied heavily on the PAC team at the Brockton Multi-Service to share advice on safe community visits and how to remain safe in the community, because we go to a lot of areas that usually sometimes we'd have to have two staff with us, and we weren't able to drive together and things like that. So we were constantly revising what we do and talking about it and supporting each other. And we really had to prepare the day before for the next day, because we'd be working mobile from our car and not being on site. So everyone had to have all the PPE and the equipment. And I think we did a really good job, like real quick, like doing PPE training, distributing PPE. I mean, whoever thought we'd be talking about like reusing a mask? But these were the realities we were faced with from the beginning of this. So I know that myself, I increased my visibility in the group living environments in the Brockton area, and just to support the staff, because I think they felt like, oh, we're still at work 40 hours a week, and everyone else off sites is scheduled, being staggered or their schedule, but we're still here. And there was still a lot of unknown about you going home and then being with your family. Like, are you possibly, infectious or spreading this virus? So we did a lot of inventive things. One example is we did have a positive client, a young woman, and the nurse would drive up to the front of her house. We'd call. The nurse would also bring the water, because the client would have to come out to the porch to take the medication. We just did so many things that met the need of the client and kept staff and clients safe. I would like to say that the other things we did safe was always revising visitor policies. Who can enter group homes? Can the visiting nurses safely come in and care for somebody in the community? So there was a lot of liaison with local community groups, including the public health department in Brockton. Actually, the nurse over there became one of my closest colleagues during this. And so that's a friendship that's been forged out of a pandemic. So that's nice. And we'll continue to do that now that we're facing this other, this rise in community infections right now, and with the emphasis of trying to keep ourselves as safe as possible. What I'm also thinking is that the PPE issues, I mean, I think we're at a good place right now, but we still got to be mindful of using PPE, making sure we're using what is the recommended use, and that we're using it correctly. So, constant reminders. If you see somebody, say something, and, just support everyone during this time that we're facing. And hopefully the end is, I don't want to say near, because we never know when this is going to be over, but we're going to be in masks for quite a bit longer now. So, just everyone working together is going to help and lead this to fruition. All right.
Kathleen, I don't know if you can hear it, but I think there's a lot of people knocking on wood right now, hoping for that same thing. And with the context of what you just shared, I'm so interested to hear Shannon, as the program manager at PACT, how did this work for all of you?
Well, it was very interesting. A typical day in PACT life before COVID consisted of our whole team meeting face-to-face every day to discuss our clients and plan our visits for the day. The success of the PACT model is heavily reliant on face-to-face visits. And when the pandemic started, we knew there were going to be multiple challenges as we did not feel we could fully suspend in-person visits without sacrificing the care of the individuals we serve. We were given equipment to utilize telehealth for treatment. However, we knew we could not use this with most of our folks for a variety of reasons, including feeling it would not provide the level of clinical intervention many of them require to remain in the community. When the governor ordered that most people were not to report to work on Monday, March 16th, my team and I knew that we needed to come up with a plan to address the needs of the people we serve, some of whom we see every day. Everyone on my team volunteered to come in, they're troopers. However, we needed to get permission just to have people in the building for anyone other than supervisors and nurses, which we received. So about half of us came in. Those of us who came to the building, we immediately began discussing our clients by going through the list of everyone enrolled in our service, and we tried to determine who we believed could not have a lapse in visits from us. We were given masks and gloves and other PPE, in addition to lots of hand sanitizer by our infection control committee. And in particular, Kathy, she took very good care of us. She's been great about anticipating our needs, and she's kept our supplies replenished throughout this whole time. She made sure we all, kept reminding us we need to have plastic bags with PPE in our cars at all times, with fresh masks and gloves and goggles even. With regard to day-to-day operations since the pandemic began, we were not able to continue our team's daily face-to-face meetings, obviously, but we were able to get a WebEx account set up, which allowed us to continue the meetings remotely, with some staff working in the building and some working from home. We would discuss the plan for the day at the end of the meeting as usual, but what was different now is that we had to include a discussion of what staff working from home would be doing and who they would be seeing and when. Because typically we'd all be congregating at the beginning of the end of the day at the building, but we're not doing that anymore. We also made plans for how we would COVID screen individuals with whom we needed to have contact, which proved challenging as many of them either do not answer their phones consistently, do not have a phone, or would run out of minutes. Therefore, we were not always able to pre-screen. This resulted in us having to carefully navigate some of our encounters, which were, as Kathy said, were often outside. Our nurses who needed to administer antipsychotic injections at times would have the full gown, face shields. It looked pretty interesting in some of our neighborhoods, Brockton. The team would maintain contact with each other throughout the day by phone and text, just keeping us updated on who was seen and what's going on with them. For individuals we determined might be at high risk or who would need the support of more than one staff person, we would team up and go together. But where, like Kathy said, we would, ride together previously, we would use separate vehicles and we would meet at the location with proper personal protective equipment. We rarely transported clients. We had agency vehicles we could use when the need arose. But instead we would typically, like for grocery shopping, we would go for them, particularly for some of our older folks who are, and those who are medically compromised, we have quite a few. For our team, we had some significant observations as we worked our way through, the summer in particular. We kind of had some revelations. The first was that the individuals that we serve are extremely resilient in a way that surprised us, even at the time. We expected to see some deterioration in mental status, but we really didn't see this. We had no increase in psychiatric hospitalizations from prior periods, and the majority of our clients were able to remain stable and safe in the community. The second thing we noticed is that coming to work helped us, and it was good for our morale. We acknowledged how lucky we were to have jobs, for one, where a lot of people were on unemployment or just, lost their jobs. And also that we were able to have contact with each other in some capacity and with the individuals we serve, which helped us cope with our own anxieties during this time. And when what other programs were working on reopening plans over the summer, like in July and August, and having to manage the angst of beginning to see people face to face, had remained operational because we had already kind of dealt with that. So it was pretty much smooth sailing in the new world. And now it's back to you, Earl.
Thank you so much, Kathy and Shannon. You both are heroes for the work you're doing. I just want to remind folks that you can ask questions in the Q&A chat box. Those can only be seen by the panelists and the folks helping us to hold this event. They can be asked anonymously. And I'm sure folks have lots of questions about how Kathy and Shannon were able to do what they said so easily. I imagine it must have been incredibly challenging. So thank you, and we will see you in just a little bit.
Thank you, Earl.
I'm really fortunate now to be able to introduce our next panelist, Susan Gittow, an outreach worker from VinFin, someone who has navigated this in so many of the ways that everybody else in our community has, and is out there making sure that the folks who receive DMH services are acknowledged and seen and cared for. Susan, I hope that's not too big of an intro, but I think really highly of you. Please share with the rest of us.
Thank you so much, Al. Good morning, everybody. My name is Susan, and I'm here to discuss with you the key points we used as a team to help our person serve during COVID. It is a challenge, it still is, and we don't know how long it's gonna be a challenging time for all of us, but the key role here is to what we are doing to take care of it. First of all, when COVID started, as a team, we knew it's high time we start educating our person served on harm reduction, because not all of them have access to like the televisions and all the information passing around. So we will educate them on harm reduction skills, making sure they have masks, and them that didn't have, we alternated as staff to distribute masks provided by VinFin. Also, we help a lot with validation, getting to know their feelings, getting to know what it is about COVID that they really worry about, how they feel inside, meeting them where they are, educating them not to worry alone, to protect themselves, knowing that if they protect themselves, they're protecting the neighbor and the community at large. Secondly, we wanted to ensure that we try the best we could to make sure that they have their basic needs met. Food, they are getting their medications. They are able, for them who have existing condition, and they depend on like food pantries. And at that time, nobody knew exactly what was going on. So VinFin provided gift cards for people who have special diets, and as staff, we rotated to go grocery shopping for them. We will educate them on how we're gonna meet and give this food, ensuring that they have the PPE and we have the PPE to protect ourselves. And we managed to shop for them. We managed to provide them with a mask. We managed to, VinFin managed to provide smartphones for our person serve who are either at risk of losing minutes and maybe will not make to keep up with the telehealth appointments. And those really came in handy because we had peer groups running every day, and most of them were able to join and see their peers, and they managed to get extra support from that. Also, for the people that we felt like they were at high risk, we helped with coordinating with their nurses, their therapists, their prescribers, expressing our concerns to them, and being able to see how they could get more help. And that really was helpful for them. On the other hand, during this time, we found that cognitive behavior therapy and interviewing skills came in handy, as they were able to, our clinicians were able to assist them a lot on this and really helped regulate their emotions. And using the evidence-based practices, they were able to understand like where they are, how much they're growing, what the challenges are. And for staff, it also wasn't an easy time because we needed to support each other, including myself, because my husband and my daughter tested positive more than once. So I had to isolate for 2 months in total. So my team daily meetings came in handy because I was able to express myself. And trust me, at that time, there's nothing as good as knowing somebody somewhere is listening to you and understands your trouble. It's a challenging time for all of us, and I will encourage all of us to keep up with a good job. You may not know how many lives you're touching out there and changing. Let's do this. Let's continue educating our person served with the key points: maintain social distancing, wearing a mask, help them with whatever else that they need depending on individual needs. And together we can fight this. It may be here for a while, but we will do it at some point. Thank you all.
Thank you so much, Susan. And thank you so much for sharing that part of your life with us. I know that that's a big thing, and so many of us are dealing with that. So someday you're going to run the world. I'm grateful to be around for it.
Thank you.
Thank you.
Thank you too.
So now I get to have a little bit of Western Mass pride, which I think folks know. I have that all the time. Our next presenter is the psychiatric rehabilitation respite clinician for clinical and support options right out here in Western Mass in Greenfield. But I think the way he introduces his title, how he thinks of it, is better than that. So that's my criticism for the day. We're really fortunate to have such an experienced, thoughtful person who is out there working with folks who are experiencing psychiatric emergencies. Thank you, George Slumpsis, for being with us, and the floor is yours.
Thank you, Earl. Good morning, everybody. Yeah, I do, after 44 years in the field, I do have the informal credential of direct care lifer. So thanks for mentioning that. But seriously, it's an honor to participate here and to reflect on this vital topic and to pay tribute to a colleague we tragically lost too soon. And one broad reflection I had on this topic is that by having better safety and staff confidence about safety, we can provide better services. And more specifically, an essential factor to maintain and enhance safety, to me, is staff skill level. And I mean that in a couple of ways. One is in working with clients directly. And a key skill there, I think, is the motivational interviewing counseling approach, with its components of empathy, reflective listening rather than off-putting questions, avoiding arguments, and rather trying to help an individual to develop discrepancies. And an example is a scenario I've encountered often where someone's staying at respite, is getting frustrated, angry, escalating, and trying to reflect to them, realize you want to continue your stay here, and we want to support that and want to figure out together how to have your conduct match the expectations so you can continue your stay. So trying to work together with them. And our agency has been offering MI trainings more frequently. We've also, for a few years, had monthly practice sessions, which are very helpful to keep your skills honed. Those are mostly attended, unfortunately, I think, by folks at the clinician level. And I try to encourage more counselors to attend those, because in my experience, the skills needed in a milieu setting, where you're dealing with a bunch of different folks rather than a one-to-one in-office session, are really challenging and complex. And I respect that, and I think these skills are very relevant to that. The other area of skill I found is very important is for staff to be assertive in expressing their concerns directly to management, rather than talking amongst ourselves about how bad things are. And examples in my setting would be speaking up when someone's being considered for admission, if there are particular concerns people have. During a stay, if problems develop, do not hesitate to contact a supervisor, including on the overnight shift. You really need that kind of backup to maintain safety. and also to clearly convey to managers the firsthand experience of a difficult event. Because I've experienced that sometimes in multiple tellings through layers of management, it gets kind of muted. And when a director or something hears from a staff who experienced it directly, say, oh, I didn't realize it was that bad, or I didn't realize all those details. So I think this direct communication with management and speaking up like that is so vital for individual staff and for the program generally. Speaking of COVID, I'm proud that throughout we have continued in respite and in our outreach work, which I also do some of, to provide direct face-to-face services. And obviously taking the necessary and advised precautions. As far as that one indirect risk I've noticed with COVID is the frustration people have with the restrictions or the requirements, like limited time out in the community or mask wearing. And that can lead to tension and conflict. So that's one experience that I had with that. And one outlet for that I found is helpful. Another hat I wear is I'm the human rights officer for the program. And by being really clear about that, having postings, mentioning at meetings, so that's known, I'll have clients come to me with situations that have been troubling to them, they're upset about, and it really provides, I think, a necessary and helpful outlet. It's a safety valve, if you will, where someone has someone they know is in an advocacy role, and the vast majority of these don't lead to a formal complaint, but they handle informally, and I'll pass the concerns along to management, and they often get addressed, and it really helps diffuse and help to manage some of these stressors and tensions that we experience.
Thank you so much, George. It's always good to hear about human rights on a Thursday, huh? It's an incredibly meaningful part of the work we do. And thank you for taking the time to be here with us today. And again, if folks have questions for George, he'll be around to answer those. Next, we're really fortunate, somebody who I'm sure has a very, very time-limited schedule, who has pulled themselves into this with us. An adult community clinical services team lead at Elliott Human Services. I'm excited and proud to introduce Eleanor Corcoran.
Hi, thank you, Earl. I think I'll start by saying that the past few months since the pandemic began have been extraordinarily challenging and unlike anything I think any of us ever anticipated when we entered this field, and nor our staff or our clients or our families. And it's been quite a learning experience in the most recent weeks in which we have seen numbers just kind of catapult off the charts. I think that's affected morale in many ways, and including for myself. And I have to say it was a nice exercise and somewhat cathartic for me to look back and see the changes that we made to prioritize the safety of our clients, our staff, and the communities that we serve in. Generally, when it comes to risk at Elliott, client, staff, and community safety have always been our top priority. And our approach to that has always been really data-based and clinical. So aiming to predict and therefore prevent incidents of future risk. And in addition to safety, of course, we greatly value evidence-based practices and assertive client care, but also our partnerships and collective responsibility to the community that we serve in. This pandemic really challenged us to pivot our approach to services and in a way that did not compromise client care. So as DMH vendors, we're really important members of the towns and cities that we serve, and our relationships with those communities dramatically impact client outcomes. Our relationship with the MBTA, the DTA, libraries, fire departments, food pantries, courts, housing authorities, grocery stores, outpatient offices, community-based programs, all of that is how we help our clients navigate their recovery. We help our clients navigate these challenging systems, and a huge part of that is in that being effective is our reputation with our community partners. So early on, it was clear that Middlesex County, which is where we are in the DMH Metro North region, where we serve clients, was the hardest hit county. We knew our collective responsibility to our community was critical and would impact that reputation. So pivoting our approach to honor that while not compromising the quality of clinical work we do with clients was definitely no small feat, but certainly an urgent one. We had to start planning right away. And so we addressed that in a number of different ways, and almost in some ways all on the same day. And it was clear that many of our, we have a lot of meetings with staff, and to prevent, the risk of all of us being down, we stopped meeting in person. We moved all of our team meetings to Zoom, our daily meetings. And then from there, we prioritized who's in the office when, and educated staff first and foremost, and supplied them with as much PPE as possible. The next step was a focus on clients. We had to educate clients right away on what was going on in the world and what the risk was to them as just a citizen, but also their unique risk needs based on their whatever compromised health conditions they live with. We then had to really adjust our services to meet whatever those needs are, while also addressing clinical needs. And for many of our clients, that meant we meet outside instead with masks and gloves. For other clients, it meant, it means we go to the grocery store for them instead of bringing them to the grocery store. It's very apparent to us that we have more resources to practice universal precautions than our clients do, of course. And that really relates to our relationship and our responsibility to the towns we serve in, that we have a reputation with. If our clients are less likely to be able to be safe in a grocery store, then we should be taking that on for them, for the greater good of the area that we serve. We identified high-risk clients. That was huge. And those clients are people who we were calling every day, seeing frequently, but as safely as possible, but calling every day to monitor for symptoms. We also looked at all of the evidence-based practices that are critical. So there's the essential needs that we provided, of course, food drop-offs. We turned into a pharmacy delivery program, and we turned into med delivery. Well, I guess we've always been med delivery for MAP. But that being said, the evidence-based practices that we value so much, a lot of that could be moved to virtual meetings with clients, which has been very effective. And I think my biggest takeaway in ending and sort of summing things up, and I think what I'm most proud of my team and the clients for, is that an inadvertent sort of outcome from what we did was really about trauma work for clients, because it was the first time our clients have really been just as important as everyone else in terms of their behaviors. Their choosing to stay home is just as important as a CEO choosing to stay home in terms of keeping the community safe. So their responsibility for once, because we know they live with stigma and shame and poverty and all of these things, that all these messages that they take from the community, which we know isn't true, but they internalize that. And this was a huge opportunity, and is a huge opportunity for them to be equal. And that has been a remarkable thing to see, if there's a silver lining.
What a great job hitting the mark there. That was fantastic. I think all of the folks we have on the panel could probably talk for the full 2 hours about just what the last 9 months have been like. And I would invite folks to, again, ask questions and reach out, because Eleanor is also going to be here with us for the Q&A. Again, back to my Western Mass bias, and also as a certified peer specialist, it's an incredible opportunity and honor to introduce someone who's going to, I think, offer a really interesting perspective. From the Breen Center, a certified peer specialist, Jessica Barassa.
Good morning, everybody. Thank you for all coming and sharing this with everybody. This pandemic has really had me thinking that never in history
Jessica, we're having just a little, Jessica, sorry to interrupt. Jessica, we're having a little bit of
entire
technical.
world has experienced some sort of transformation, whether yeah.
Jessica, we're having a little bit of technical difficulty, so maybe we'll go to our next presenter and then bring you on right after them.
Okay.
Jennifer will check in with you about the connection status. Okay, now we will build some suspense for Jessica. She'll be right back with us. And that'll bring us to our next panelist, Mallory Harris, Milieu Supervisor at the Home for Little Wanderers. Children are important. Children are maybe our most sacred duty as a group. And I think Mallory has some really interesting information to offer us all on children and their supports. Thank you so much for being here, Mallory.
Thank you, Earl. Good morning, everyone. I definitely want to thank all the other panelists as well who have just kind of highlighted all the hardships COVID has brought to workers in this field. In saying that, I do want to also address some of like the silver linings COVID has brought in a way that I'm kind of thankful for what this experience has brought me as a worker. When I think of COVID, I think it brought occupational safety to the forefront of everyone's minds, which is so important in this field. And when I think of that, I also am thankful for my agency, and it helped me realize how they've already been supporting me in feeling safe and supporting workers and doing the work that we do. And one of the biggest toolkits that we have in my organization is training. I'm also a certified trainer for my organization, so I can understand how important it is. One of the biggest toolkits, that the training provides workers is something called the stress model of crisis. I have a little slide up there, yeah. So one of the biggest things our training does is kind of give people who may not necessarily have experience with these clients or in this field, but have the passion, different visuals and models to understand what a client may look like in a potentially violent situation. To not only keep the client safe, but to keep staff safe as well. So the stress model of crisis kind of gives staff an understanding of what a client may look like pre-crisis, which is like what they typically would look like every day, all the way up to outburst, which is where a client may be in a potentially violent situation. So not only does it help us identify a client as they're kind of moving up that scale and getting potentially violent, but also in each of those phases, it gives you different little toolkits to utilize to hopefully de-escalate the situation. Like I said, I think training, and especially the stress model of crisis, is one of the biggest things that will keep us safe in the field. And I think after training, one of the most important things is like agency follow-up and like application in the field. So when I think of when I first started, I was fresh off of training. I definitely did not know what I was getting myself into. So the training that I was provided was really helpful. So when I started my organization, we were having a lot of meetings around a new client that was coming in, and they kind of brought out the stress model of crisis and helped us identify, before we even met the client, what he was going to look like in each of those stages. So if you fast forward a couple weeks to where we actually received the client and I was working with him on the floor, I got into a situation where earlier that day, his family had canceled a pass. And I was just kind of minding my business, serving lunch. And he had asked for dessert, to which I said no. And the situation escalated all the way to like that violent outburst at the top of that model where he had a knife and he was threatening me. And as a person, I was definitely terrified. Like my fight or flight kicked in where I was like, I should just run away and not do this job anymore and go do something else. But then after that initial like 3-second moment, my training kicked in the meetings I had had with my supervisors, where they had reminded me what he was going to look like and different skill sets to use kicked in. And so my fight or flight kind of diminished a little bit. And I remember my supervisor had talked to me about one of the biggest tools we could use for him in that outburst phase would be something called distraction and redirection. And this client in particular loved Pokemon. And at the time, there was a game called like Pokemon Go, where you would put it on your phone and like chase Pokemon around. So as this client has a knife to me and is threatening me, instead of running away or yelling or whatever, I pulled up Pokemon Go on my phone and started just chasing Pokemon around the parking lot. And he eventually like put the knife down and started chasing Pokemon with me. So I was able, through the stress model of crisis and Pokemon Go, able to leave a potentially violent situation. And then later that day, at the end of the shift, I kind of debriefed with my supervisor and we discussed how I could also, one, get out of that situation again, hopefully prevent it. And two, the follow-up I was going to have with that client to help him grow and so he could avoid those situations. So in that sense, that agency follow-up in those meetings, along with my training, helped me feel safe in that moment, but also helped me provide safety for that client, which is just very important. And I think in the times of COVID, all of this stuff is still really important to have the forefront of our minds, because I think in the world right now, we're kind of stuck in the let's just get through this phase. And it's really easy to like adapt that mentality. But in this work, we can't just expect the kids to get through this. We want them to grow and to learn, and we want staff to grow and learn. So I think getting out of that, getting through it, like COVID mindset, and just adapting, like once I feel safe and kids can feel safe, we can really dig in and do that deep work and give them the coping skills that they need. That's where the real work really begins, and why I'm just really always thankful to be a part of this field.
Thank you so much, Mallory. That sort of real world opportunity to see how that training impacts your world is incredible. And thank you for the work you do.
Thank you.
All right. So as part of my grand conspiracy to put Western Mass at the end of this, to cap it off, we're going to bring Jessica Barasas back on from the Breen Center, certified peer specialist. Are we in a better space, Jessica?
Are we good? Can we hear me?
You sound fantastic. The floor is yours.
All right, so this whole pandemic has got me thinking that never in recent human history have we ever felt we had so much in common on a global scale. Nearly every human being in this entire world has experienced some sort of transformation in what our everyday life looks like. We are also feeling the impact of the lack of human contact and how it affects many people, and in this case, individuals in our communities receiving care, and even the caregivers themselves. I believe what is most important is how we express compassion, but also maintaining strong connections and strengthening our communication, not just with the people we serve, but also with our colleagues. Not only is it important to have compassion for others, it's equally important to have compassion for ourselves. This level of care can move mountains. Compassion and empathy are the keys to opening the door to true connection and understanding. Without this, we can become lost and begin to falter. I have found with myself and many others that when this happens, it's really important to step back and see if we're taking care of ourselves. The strength of humanity begins from within us. We can strengthen our self-awareness by checking in with ourselves throughout the day. We need to give ourselves the chance to gain the ability to slow down more when we need to. And most importantly, being okay with stepping back and honoring these needs. We can use that time to get in touch with who we really are, which in turn can help us connect on a deeper level with others. Social distancing doesn't mean emotional distancing. If anything, this can bring us closer. We should also do ourselves a favor and others and be selective of what we see on the news. There's so much negativity out there, but there's also so much good around the world. People are banding together in beautiful and creative ways. People singing and cheering out their windows, saying hello with the most genuine and loving smiles. They might be physically apart, but we're emotionally bonded. Everyone around us just needs to know that there are people out there who are saying, I see you, I care about you, and you are not alone. Currently, some of us are able to meet with the people we support in the community and guide them through what is available out there. I find it to be much more clear that everyone just needs and really wants to know that the world isn't as bleak as they had feared and that there is hope. I see this in others and I also see it in myself. Grief is different for everyone. There is no one way to get through this sort of emotional pain you might be feeling. But one thing we all have in common is our inherent need for genuine human connection. We are all experiencing this together. And there are people out there who need to know that they're not alone. My role as a peer allows me the freedom to mutually share life experiences with others I support in the community. We share our own personal struggles and how we have learned to get through them. We share milestones that are worth celebrating. And we share all the ups and downs of life. What's most important that is many of the people we support are more resilient than they may realize. And they need to be reminded of that. Every single individual I talk to has the answer right within them. And all everyone really needs to know is someone is really listening to them. And we need to work on validating their experience. A small thing like just listening and giving someone time can really make a huge difference. And with the current rise of cases and the need for further social distancing, many individuals who receive mental health care, and even those in crisis, sometimes don't have in-person care available to them when they need it. When that help does become available, it is commonly through phone or Zoom. When caring for others in this way, we must pay close attention to the detail in our communication. Even the lack of what seems to be simple nonverbal communication has a huge impact on how we achieve the connection we need to form with the people we serve. And in this case, I think when you are socially distanced from an individual or colleague, you're conducting a Zoom meeting or telephone meeting, it is hugely important to reflect back and validate and empathize with the other person and what they are saying to you. Communication is vital when working in the mental health field. And in my opinion, a strong sense of camaraderie is made even stronger by true compassion and connection. Prior to this pandemic, I feel like so much of the magic happened when sharing an office with someone. And during daily meetings with my colleagues, we were all able to share and express so much more and learn from each other. Now, many of us find ourselves mostly communicating through emails instead of just popping into someone's office and speaking one-on-one confidentially to a team member. Verbal and even nonverbal communication offers so much to us as professionals and as human beings. It's just in our nature. There's so much more to be shared that sometimes we can't fully express without in-person contact. The art of communication can be lost during social distancing. Many of us are learning along the way how to redefine what our forms of communication are. I really find that Zoom meetings and phone calls with my colleagues are really helpful and are the best we can do right now. It can allow us the time we need to remain on the same page. And most importantly, it can give us a chance to be able to take care of and check in with each other. Thank you.
Thank you so much, Jessica. That was like another mindfulness practice. That was really, thank you so much. I think, all right, now you're gonna get to see everybody again, and not just look at my goofy face. So I'll give a second for that, for folks to come up. If, as this is happening, if folks have questions or you have things that you would like addressed, I will read out the questions and then we'll give folks some opportunities to answer those. So just waiting for a couple more folks and we'll be ready to go. You guys all did really good. I hope you know that.
Thank you.
Thank you.
So our question number one, and maybe Shannon, we can have you start with this one. and then if other folks want to chime in. Have you seen an increase in psychiatric evaluations for Section 12s? I think the implication is really around since COVID has really come up.
No, that was one of the remarkable observations that we had. We really didn't. There was one notable example of somebody who was hospitalized, and she hadn't been in the hospital for like 15 years because she was very disrupted by not being able to engage in her typical routine. Every Monday she'd go shopping, banking, go to the cigarette store, all that stuff. And because we had to take that stuff over for her and do it for her, it really, really dysregulated her. To the point that she stopped taking her meds and but no, otherwise we really didn't. We saw no increase in Section 12s or hospitalizations.
Eleanor, you seem like you might have a thought on this as well. George, I'll come to you right after, don't worry.
Yeah, I would have to agree with that. It was pretty stunning. We had, in fact, it might even have been a decrease, and I don't know if that's because clients were wary of ERs and not wanting to go there, or if even though we were seeing people less, we were talking to them more. But they did remarkably well, all things considered, much better than we anticipated. And I think we saw an increase toward the end of the summer. I think when people started to really get worn down and see other people out and about, and and there were also a lot of other conflicts happening. The news has been really difficult for clients too in general. So there were a lot of variables there as well that really peaked at the end of the summer and more late recently. But it was astonishing how few hospitalizations we saw in the pandemic because of a decrease.
Sorry, Eleanor.
Oh no, that's okay.
George, you had a thought on this as well?
Yes, thanks, Earl. Excuse me. We, I think, similarly haven't seen an increase in psychiatric crises per se, or people being sectioned. But I did want to comment that we have, since at Respite and Crisis, we serve people with all kinds of situations, crises in the community, and we have seen the impact of other resources being so limited in their availability and barriers put up to them, whether shelter situations or lack of other who are homeless, lack of other resources in the community, or barriers to getting referrals if people need COVID tests, stuff like that. So it's an expanded answer to that question of limitations that are there in the community for resources.
Thank you, George, for that context. So, not necessarily in those psych evaluations, but folks are more resource needy in other spaces. Mallory, in the kids world, since you are our kids expert for the day, how have you seen this show up in that world?
I think there's definitely been an increase in anxiety, and I think also part of what contributes to that is that we've had, since March when all this started, just a development in our policies and things like that. So kids who may have been in the system or have a good understanding of what to expect from us were thrown off by the fact that we didn't have all the answers. And so I think you saw an increase in maybe behaviors or a little feeling of hopelessness, which definitely would contribute to the need for an evaluation and potentially a higher level of care. I think the way we addressed that in my agency was just transparency in terms of hey, in the world, none of us really know what's going on, and kind of giving us a common bond with the kids through the experience of we're all going through this. So we're going to learn together, and also just trying to get their input in policies and things that would affect them, I think was helpful in diminishing as much as possible the need for external evaluations if we didn't feel like it was really necessary. If that answers the question.
That was an answer, certainly.
Yeah.
Kathy, I think this question is for you first, and then we'll ask everybody else if they have an opinion. COVID fatigue is a real thing. How are we going to keep people focused on the importance of PPE, social distancing, all of the rest of it as folks are kind of, I know myself, I have become a poor teacher. There's lots of things. That stress is very real, and I think folks wanting it to be done doesn't make it go away. So in your opinion, how do you think we navigate that?
Well, I know, because I often feel like a broken record when it comes to PPE and the reinforcement, but I also think people understand that where we are right now in this state and throughout the country with the high numbers and that kind of thing that we have to do, and it's on a community level, everything we can to keep safe. I actually overall think GLE clients have done a tremendous job, like wearing their masks, and like, I don't know how many times you can say to someone, "Did you wash your hands?" And still like be pleasant about it. So it's something we all are facing, and I try to like reinforce by personal conversations with people and emails, and I just have to make sure that I don't look at who didn't read my email. So it's just reality right now. And I just think we just got to keep trudging ahead. It sounds like, we're doing the best we can, and people having slips. I mean, we're dealing a lot now with people identified as close contacts and other things. So like my mantra is always, don't become a close contact. Limit your visitations or that kind of thing. And I've had to personally deal with some of these issues because I have a son in a residential program, and it's just, what we're bearing right now as a society. And we all have to think about safety for everyone.
Absolutely. Thank you for sharing that with us.
Oh, thank you.
Susan, I'm interested in your perspective in this as you're out there in the field working with folks. How do you keep the folks you see in the game?
PPE all the time. That's the key. I know that really works because when my husband and my daughter tested positive for 3 times, I have a 2-year-old and myself that we didn't test positive. And we managed to stay negative all the time they were positive. So I know that PPE works miracles. So that's my message to everybody. That's what I preach to my person served. PPE, 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 and provide to them. I always have it in my car, like I buy like a bunch of it. So if anybody doesn't have like enough, I will always give them, because you can save a life through that. You never know. So PPE is the key. Washing your hands very well is the key. That's all we have to continue preaching for now.
Yeah, I think reminders are going to be helpful for folks, right? I am one of those. I'm the terrible guy who runs to the store, forgets my mask, gets sent back to my car. So I've just stopped going to the store because it gets embarrassing after a minute.
Exactly.
I think this is a question for the larger panel, although maybe George and Eleanor, if you want to take the lead on this one. Has anyone seen an increase in substance use, and has treatment been accessible?
I'll go ahead. I don't know statistically. I certainly think anecdotally there's been some increase because people don't have the resources. I know a few months ago, in-person AA meetings started around here outside. But again, the lack of resources, I think, have had an impact on substance use patterns, as well as other, sources of stress and distress.
Eleanor, do you have any thoughts on this one?
Sure. Yeah, I wouldn't say we saw an increase. I think people who were pre-contemplative and actively engaging in substance use remain that way, and we haven't necessarily seen an increase in that. And I think the bigger issue has been people who were newly sober and in sobriety when the pandemic hit. And like George said, the AA meetings going remote and pretty much every other structure our clients have going remote, which of course is a huge component for remaining sober. We relied heavily on our recovery coaches for that. Their use of self-abilities went to a new level. Self-disclosure has always been a secret weapon, but But for them to be able to say it's hard for me to not go to a meeting too, and I'll meet with you outside and we'll go for a walk, has been paramount.
Oh, thank you. And Shannon, I'm sure at PAC this has never been a challenge you faced, but what are your thoughts on the availability and need for substance use services in our current moment?
So like Eleanor was saying, we didn't really see any change one way or the other. We actually have people who are sober in our program have been sober for like decades. So they didn't struggle a whole lot to maintain it. There are virtual AA meetings and the dual recovery groups that were remained available. But in terms of access, it was like, and I'm not even necessarily speaking for my program, I'm speaking for the agency. You know, you had to get COVID tested to go anywhere. So, you know, and initially it took a couple of days to, you know, a week to even get results back. So it was a huge deterrent for people because people they didn't want to get them if they didn't have to. And so, of course, that was a reason not to seek treatment. And, you know, if you were sitting in an ER, it took a couple, 3 days to come back if you were waiting in an ER for like dual diagnosis treatment. The courts were minimally operational if you were going to try to pursue a Section 35. So yeah, accessing treatment was definitely sort of, you know, in the, you know, anecdotally within the agency, and helping our clients get into treatment was a problem. Yeah.
Thank you. In the interest of time, I'll shift to a question, but I think that's something we should all be thinking about as we move forward. Mallory, this one is specifically for you. Is the Home for Little Wanderers still using peacemaking circles? This is from Jeannie. I'll read the rest of it because there's some good context there. This is from Jeannie Bass, who identified herself there. I really appreciated the Home for Little Wanderers workshop on your use of circle a couple symposiums ago. If you are still using peacemaking, how has COVID affected this practice? Thank you.
Yes, we definitely are using the circles. We call them restorative justice circles, and we offer a lot of trainings as well on that. In terms of COVID, it's definitely exacerbated the need for peacemaking circles. In terms of when you think of kids and the remote learning, and also there's more restrictions on what home visits and things are looking like. So the kids together are spending so much time in one area that there's just right now I work with 13 to 19-year-olds, there's just bound to be an increase in altercations, whether verbal, physical, whatever. So the need for these circles has come across a little more frequently than normal. I think we found ways to adapt it, whether it's virtual, because in these circles, the kids get to choose like a staff person who will support them in the mediation of the circle. And so whether it's virtual or we're just everyone keeping 6 feet and making sure we have our PPE ready, that's the only real negative side to it that's made it a little more difficult, but they've definitely occurred more. And in that, we've been able to perfect the art of the COVID restorative justice circle, which has been.
So, Mallory, I have a follow-up question that is maybe what I should have led with, which is, what is a peacemaking circle or a restorative justice circle?
Well, restorative justice is typically when an event happens. I'll use the example of just like 2 teenagers fighting. It's hard in the milieu space because even after we use our interventions, whatever they may be, in the like outburst stage, the kids are still expected to live with one another. So it's like they still have to find a way to share the space. And oftentimes there's like a bond or a friendship that was there previously. So what we do is just try to come together. And like I said, the way that restorative justice specifically occurs, but I'm sure in any type of peacemaking setting, it's very similar, where each client that was involved in the situation would choose a staff member that they feel supports them, and you kind of all sit in a circle form. It's kind of just an open forum to kind of air out the situation, with just the underlying like ideas of like respecting one another. You definitely have to time it right as staff members, because right after a situation occurs, you're not going to sit those 2 kids down in a circle together because it would just be like a rematch. So there's a work that goes into it prior where it's like understanding the two clients' point of view and where they're at in terms of if they're ready to recover and grow.
Thank you, Mallory. We learn something new every day.
Yes.
And then just kind of one final question as we, I think, are winding down here a little bit, but a big one. So don't get your expectations low. I think this is for everybody, but Mallory, maybe you can lead off with us because I think you touched on this a little bit. Can you talk about restrictions to family visits? And I think we can talk about for folks who see their family in the community or in a setting, those kind of lack of in-person regular interactions that folks have seen. And how have you worked around or supported that? Jessica, I think you gave us a really, really important perspective on that. But I think just in the technical sense of that, for folks who are working at like George the Respite or places where people are spending lots of time or the majority of their time, how are you navigating around those restrictions, both in the practical and in the clinical?
You said you wanted me to go first, or?
Unless you really don't want to.
Oh no, I will. Sorry. So I work in, like I said, a residential setting. So family visits have definitely been impacted. Whether we have kids that parents typically would come on site, or they would go home for like a regimented weekend pass. It's gotten a little difficult because obviously with COVID, it means more exposure. Whether parents coming in or kids going out. And right now, I think we have 22 clients. So that times all the family members they're supposed to see definitely gets a little tricky. And since March, we've been working, it's kind of touch and go in terms of we're developing those policies to make sure that we're keeping everyone safe in terms of exposure in the pandemic, but also making sure that these kids get that family connection. Because our goal in our agency is always just to get the kids back into that family setting. So that is such an important piece. So in terms of like hazard, we definitely provide PPE and certain rules, regulations around like duration and exposure. In terms of the clinical piece, I think the clinician and the clinical department that I work with directly has done an amazing job where they're now also kind of, we have parent partners and family clinicians, but even clients, individual clinicians are incorporating the family work in terms of dealing with, you have parents who are anxious that their kid who resides with 22 other kids is coming home. So they're doing a lot of that back end work to ease the anxiety of all of us. And it's anxiety that we all have. So like I said before, it's kind of like a mutual understanding, but we give them the clinical follow-up and also just reminding families of our policy that like this whole thing is about is we're there to keep everyone safe. And that's in the forefront of our mind. But it's definitely an interesting.
Thank you, Valerie. Maybe Kathy, I don't want to put too much pressure on you as the nurse, but maybe you have some thoughts on how visits are being done, how they could be done, if there's any things you've learned about that are helpful for folks.
Well, I know we've had since visits, I think restarted in late June or July, that in at least the group living environments, it's still a restriction. And I know George talked a little bit about the human rights issue and restrictions, and it's very difficult. And, to say like you can meet outside with someone for 15 minutes, 6 feet away, and like it was so specific, like you couldn't hug someone or touch someone or share food with them. And it just brought to mind like how serious this is and like how that's being monitored on their behalf. Where like if I went and visited with someone and shared food, no one was there to like say, don't do that, Kathy, or that kind of thing. So it felt really difficult to implement, but it was mandated as part of the visitation policy. And I never felt so much relief than when it got loosened a little bit and, you were able to visit, or you could have 2 visitors sit outside with you and that kind of thing. And, the response to that was just great, because it's, the one thing about this pandemic that we'll remember is when people have been ill and not being able to be with them.
Yeah,
it's
absolutely.
been a huge, caring thing for society. I mean, it's just not what we do when someone's sick. So, yeah, so I think we're back at the point that it's getting more restrictive again. And as a parent, like I shared my son, that to think he might not be able to come home for Christmas.
Yeah, that's heartbreaking. And there's nothing we can do to soften that blow, but
Yeah.
it's
Oh,
important. Survive this moment and get back. I'm a handshake person. I've worked my whole life to have a good handshake. It's really what I got. I got a strong. I don't want to build myself up too much, but I have a
strong
good
elbow.
handshake, and I have it. It's a skill I built up my whole life that is at this point in time just useless. So, but yeah, missing people is huge. George, please.
Yeah, we have had to restrict visits and the nature of visits. We had, especially when it was warmer, we were generally having visits outside. We also have, for privacy's sake, we have a larger IOP room, which hasn't been used for a while. So there's more space in there for visits to happen if that's needed. And the accommodation we have made is to, rather than have particular intervals for visiting, to be more flexible about that and ask people to plan them ahead and coordinate them with us so it's kind of staggered throughout the day when people would have visitors. But it has been a real limitation, as there have been other restrictions, and I appreciate Kathy mentioning the human rights aspect, because excuse me, I have frequently mentioned to staff and management, reminded about that 2 of the 6 fundamental human rights are for access to visitors and access to special visitors. And so just trying to keep that balance of precautions with people's, honoring people's rights.
All right. It seems like deep breath. We survived the experience. Does anybody have any last words they want to share before we go? You feel like you said enough? Well, thank you all so much. For folks who are in the who are watching this, feel free to reach out to folks. These folks are available. You can always reach out to the organizers for contact information. As someone who has been privileged enough to spend time with them, they have an incredible amount to teach us all about the work. And I look forward to seeing all of you again in the future and spending more time with you. You're really amazing folks. So have a great rest of the event. I am thankful for you all for giving us your attention. I know without the natural applause breaks of these things, it can feel a little bit weird, but I think we all felt really heard by you. And again, I think we're looking forward to being in person, but we're glad we got to share this time with you. At this point, I'll be passing the metaphorical microphone back to Commissioner Brooke Doyle, who will be presenting the award today. Thank you all so much.
Thank you. First, just want to again say thank you to all the panelists. You did a great job presenting a wide variety of very complex issues, and how the effort to stay focused on safety and good, solid care delivery and arriving at that balance is still so important to meet the needs of our clients, and more importantly, to balance the safety of our workforce as well. I appreciate all of the points that people made, and also appreciate the extra attention and call out to the importance of staying connected and being human with one another. It's really critical at this time. And want to remind everybody that points were made about the importance of just being present and listening. I feel really strongly about that as well, and just really appreciative of all of the points that were made today, and thank you all very much. The next part of the event actually is one of my favorite parts of the event. I've had the honor of joining this event since it began, and this part of the event always lifts my spirit and gives me the reason to look forward to our next Stephanie Moulton conference. In addition to all of the good information that comes forward, we have the opportunity to honor Stephanie's memory with an award for an outstanding employee doing direct care. So this year, it's my privilege to recognize Stephen Barrow. Stephen Barrow is a certified peer specialist working for the Breen Center in Pittsfield, Mass. As a staff member of a residential program in Williamstown, he consistently goes the extra mile, but remains humble about his contributions. Stephen's colleagues wanted to share some specifics about why he's so appreciative. Please turn your attention to the screen for their heartfelt sentiments.
Good afternoon. My name is Gail Markland, and I'm the site supervisor with the Breen Center.
Hi, I'm Colleen Sandrini. I am the manager for recovery services here at the Breen Center in the Berkshires.
I am Kayla Quick. I am one of the program directors for the ACCS program in the Breen Center.
And I met Steve Barrow a couple years ago when he came to work at the Breen Center as a peer support worker.
I actually was the one who hired Steve. Him applying to the Breen Center for peer support was a complete change in career. He was used to labor, had his own business, but after his own lived experience, he decided that it was time to change what he does. Just his passion to help people.
He loves supporting people.
He's a good role model. He's a hard worker.
He's not one to pat himself on the back for anything.
He's got the mouth of a trucker. F-bombs here, there, everywhere. However, don't get me wrong, he can totally pull it together in a professional setting.
And honest. He's loyal.
He's just who he is, and he uses that to really connect with other people.
He not only believes in himself, but he believes in hope. He loves what he does. Steve he's made such a difference in many people's lives.
There was 2 members that lived here at the residence, and Steve helped them start this group.
He worked really hard creating this group, Alternatives to Suicide. He was able to give them hope. He was able to help them with their confidence.
And now they are facilitating this group.
To watch how that was created and to watch him really allow the 2 members to take hold of that and run that group was amazing. Hey, Steve, I am so excited that you were nominated and are receiving this award. I can't thank you enough for everything that you have done for the program here, for me personally, for other staff, and especially for our members. You have made their lives a better place. You have instilled such hope for people that have hit rock bottom. You are an asset to our team.
I can't tell you enough how thrilled I am that you've received this award. You have certainly earned it.
Congratulations, Steve. You're so deserving of this award. And I'm glad that I got to be a part of it and keep growing.
Thank you. And now I'd like to invite Mrs. Flynn and Stephen to join me on the screen. The inscription on the award reads as follows.
Here,
Recognition. Oh, there it is. Thank you. In recognition of Stephen Barrow for exemplary commitment, dedication, and performance of direct service work to support individuals achieving recovery, December 3rd, 2020. Congratulations, Stephen. And at this time, I'd like to introduce Kimberly Flynn, who's Stephanie's mother.
Hello. Congratulations.
Thank you. The plaque is beautiful on its own, but when I think that it represents the recognition of my peers is just totally incredible. And as you can see, like the 3 beautiful people I work for, that these are the people I work for every day. It's quite an experience. And this award says a lot about them for, well, things that I already knew about, like their selflessness and generosity actually shine a light on somebody in your ranks and pull them forward. You know, and every day people assure me that I'm just a valued part of that team. And it just blows me away. Thank you.
Thank you, Stephen. And we appreciate all that you're doing every day to support people. At this time, Ms. Flynn, I'd like to invite you to share any thoughts or comments that you may have for the attendees who are here today.
I want to say thank you to everybody that's participated. Thank you to everybody that set this up. Congratulations, Stephen, and have a wonderful holiday.
And thank you, Ms. Flynn, for starting this whole thing.
Absolutely. My daughter was awesome. She was special. Never want to forget her. I'll do whatever it takes to make sure this never happens again. So thank you very much.
Thank you.
Thank you all very much. Just want to acknowledge, Ms. Flynn, your point is very well taken, that even though our event this year necessarily had to be organized in a different way, we're grateful that you were able to join us here today. And we're also really proud and honored to be able to continue to host the event. Even though we needed to do it a little bit differently, it was important to all of us that we were able to be present and to honor Stephanie's memory and to do a service to the importance of safety as well. Thank you so much for joining us here today. I want to thank all of the attendees for joining us here today. We hope that the event met the needs that you have, and we look forward to your feedback for future events. I hope everybody has a good rest of your day. And as we were reminded at the beginning of the conference today, being good to ourselves, being mindful, taking a moment to check in with each other and check in with ourselves is so important. And thank you all so very much for all that you do every single day.
So